Advanced technology in healthcare is supposed to help save lives, but what happens when computer software backfires? This week on the CBS series Whistleblower, former police officer, lawyer, and judge Alex Ferrer takes us inside this medical technology where a computer glitch could cost you your life.
It was an extremely lonely road. I felt I was up against a giant system and bureaucracy.
Brendan Delaney, an IT specialist, was working for the New York City Department of Health, bringing high-tech efficiency into patient care.
My job was converting paper records into electronic medical records.
What exactly is an electronic health record?
It is an electronic means of gathering data on a patient, so everything is automated. Lab orders, x-ray orders, medication orders.
But Brendan was shocked to find that instead of preventing mistakes, the software was creating them.
People were at risk in getting wrong tests, wrong results, and wrong medications.
Brendan knew he had to do something.
I documented, I took screenshots. I explained it in layman's terms to my bosses.
But the software wasn't being fixed, and the stakes were too high. Brendan decided to blow the whistle and consulted a lawyer.
Brendan reached across the table to me and said, "Someone is going to die."
She was a force of nature. She's as smart as anybody I ever met. Under it all, she was a sweetheart.
In Vermont, Randy Stern believed faulty software led to the death of his wife when she suffered a brain aneurysm he thinks could have been prevented.
They were going to order a scan, but nobody ever did. Somebody screwed up. Somebody screwed up bad.
It was exactly the type of fatal error IT specialist Brendan Delaney had been sounding the alarm about. He spent countless hours gathering evidence about the flaws in the health record software.
I was subsumed with this case, just couldn't let it go. It was wrong, morally wrong.
Well, Alex Ferrer is the host and executive producer of Whistleblower and joins us today. So, Alex, I think what I find so interesting about this case, compared to some of the other cases that you guys have profiled, is some of the other cases there's a specific population affected.
Yes.
This could affect any of us.
Everybody.
Yeah.
I mean, 80% of the population has their medical records in digital form. That's
me, you.
Yeah, absolutely,
Yeah.
And it's only growing. It's going more and more digital. So this affects everybody. It could be anybody across the country, and the stakes are so high.
Okay, when you say the stakes are really high, what sort of errors are we talking about?
Well, the software could bring up your personal information and somebody else's medical history.
Whoa.
So the doctor's looking at it and doesn't know you're diabetic, for example, because somebody else's medical history is there. It could be even a male. It doesn't have to be female.
Wow.
The doctor could write a prescription for a child, and the software creates an adult dose of the medication.
Wow.
The doctor could order a critical lab for you, or an MRI that is absolutely needed, and it never makes it to your record, and you never get sent to the lab or to get an MRI. It can literally kill you.
I was going to say, I mean, what could that mean? Could it mean people could die?
Absolutely, people could die. In fact, that's what Brendan Delaney, who discovered this, was warning everybody about. He was saying, look, people are going to die. It's not a question of if, it's a question of when. And they wouldn't listen to him.
When we hear about medical records, I think the number one thing that comes to mind is privacy. That's basically all we've really been talking about,
Sure.
Not these sort of errors. So when we say people could die, do we have any statistics? Do we know how many people have died as a result of this sort of stuff?
When you watch our episode tonight, you're going to find out about one concrete example of this, where the woman is believed to have died as a result of this particular software. There are many other software makers out there, but this particular software, and this particular software was in effect all over the country. But the difficulty in finding out, it's very difficult to know if somebody died as a result of a computer glitch. It's very difficult to do that. But what we do know is that medical errors are the third leading cause of death in the United States. Think about that.
That's
third,
maddening.
Behind Heart disease and cancer is medical errors.
I mean, chances are you have a medical record because you went to seek some sort of treatment to get better, not get worse.
Right. And that is third based on the medical errors we know of.
Right.
You don't even know about the ones that you weren't able to identify were medical errors or the ones that were covered up, and it's third.
You know what's going through my mind is with the software is you had one job, just to keep this information straight.
Right.
What's the outcome of that Vermont case? Randy Stern and his wife, what happened there?
His wife went to a doctor because she had crushing headaches. The doctor said, we need an MRA, which is an MRI with contrast. We need an MRA of her brain. She put it into the electronic record. It dropped right off the record. She never got the MRA, and she had a brain aneurysm and died.
Wow.
Yeah. And the story really, tonight, when you watch the show, the story really puts it all together, and you see, you know, the sadness that Brendan was warning about this, and he feels that there were kickbacks being paid in New York because nobody would listen to him. He also feels that part of the reason they wouldn't listen to him was he was working at Rikers Island and was seeing the software glitches relating to prisoners. And he goes, look, it really hurts me that I don't think they cared because they were prisoners. And he's a former cop. And he's saying, like, this is just wrong, you know, and ultimately his prediction comes true. But it's a really riveting story.
Yeah, it seems
you're gonna love this guy. You're really gonna love this guy.
Alex Ferrer, another fascinating situation, fascinating case. Thank you so much.
Thanks for having me.